Um, Martial arts technique is one thing, but sometimes the effect of training places negative stress on the body. You know, you may end up with a stiff neck because of a pulled muscle in the upper trapezius, the sternocleidomastoid muscle, which is here. Just posterior to that is a group of muscles called the scalenes, and it has 3 parts to it. These and other deep cervical muscles can get tight due to trauma, okay, where you can't turn your head left or right. So the thing you want to do is to determine, number one, which meridian or channel is involved. And if it's lateral, most likely it involves the Gall Bladder Channel, okay? Because often people with, they can't turn their heads, and you know, laterally, so there's this rotational component to it, and they say they would feel it into the middle and upper trapezius muscles, okay? All along the gallbladder channel. So what you would do is ask the person, if you're treating, you can self-treat, is to make sure you're sitting, you know, pretty square, and look straight ahead, and first turn your head where you're feeling the discomfort. So you would turn your head to the left, and then to the front, and then slowly to the right, and you will make a note of which side it feels more limitation in range of motion, okay? So in this case, let's assume that her turning her head to this side, she's feeling restriction in range of motion. Then for this particular way of restoring the problem is that she's going to choose a point on the heart meridian, heart 4. And that point, to locate it, this little bump right here, you place your thumb right below this bump on the wrist crease. That's 1 thumb width. Or in Oriental medicine, we say that's 1 sun, which is just shy of an inch. Okay? And 2, but this particular point is 1.5 sun. And now under the tendon, because there's a tendon here, right? You want to go under the tendon. So you place your thumb under the tendon, and you want to press until it literally aches. So what that means is that you have to generate enough of a stimulus to approximate an acupuncture needle. If I were to insert an acupuncture needle in there, that's what would happen. It will give you a particular sensation. All right, that particular sensation is known as de qi, D-E with an accent, Q-I, de qi. What that means is arrival of qi at the acupuncture point. There is a particular sensation associated with that, and that's what it's called, de qi. But once you locate that point, then go ahead and locate the point. So what happens is that she would now turn her head to the left, turn her head to the right, back to the front and to the left, and she will keep turning the head while pressing in order to mobilize that particular part of the body. Now, why using a heart point on the heart channel to treat a problem that's on the gallbladder channel? Most practitioners would have a hard time wrapping your brain around that, but it's really simple actually, and here's 2 reasons why, 2 of many. Number 1, if you identify the channel involved, you want to identify also, this is a yang channel. The gallbladder channel is a yang channel. Now, how many yin corollaries are there? The heart's one of them, okay, in terms of corollary. Why? Because they share the same time on the Chinese clock, AM and PM. That's why. Also, if you project an image of the upper body on the hand, from the hand to the elbow, this would be the head, this would be the neck area. And since the gallbladder channel and the heart channel are related by way of the Chinese clock, then that's a likely point to balance the channel, right, and clear it. And in order to clear it, you have to mobilize the head. Now, to clear it even further, you can do some hands-on manipulation of the muscles itself, or a therapeutic scraping technique known as gua sha. All right, especially if it's a chronic condition. So the next time we would look at using gua sha or therapeutic scraping as a means of clearing stiffness of the neck, torticollis, wry neck, call it what you want, whiplash. Often you will see this kind of problem with whiplash where after a little bump, even 5 miles an hour can cause serious problems in some people. Okay, so this is how you can clear it. Good.